Hi, I'm Claire. I had surgery with Dr. Patel with UC Health in July of 2020. Um, Prior to surgery, I was in an incredible amount of pain. I would probably rate it about a 7 or 8. And I can say that with confidence because I had a child naturally, and that's a 10. I was in basically pain every day. It definitely affected my mood. It definitely affected just kind of how I went through my day. I am a professional show jumper and equitation rider with horses. And so it's extremely important to me to be in good shape and to feel good. And yeah, I was neither of those things prior to surgery. I love to ride enough. I continued to ride through the pain, but it got to a point where I knew that if I didn't do something about it, then I was going to have to change careers and change my whole life. And I just started my search for the right doctor. I had had several spinal fusions prior to the surgery. With Dr. Patel, I knew that I needed to find a surgeon that was actually going to really look at my x-rays because I knew there was something wrong. And after a while, you kind of start to feel crazy because you've had pain. And especially if it continues after you've had surgery, you kind of start to question, why am I still in pain? Dr. Patel was the first surgeon that actually sat down and really examined my MRIs. And he's the one that found out that the fusions I had previously had failed. And because of that, the screws were loose, things were moving. And so it gave me peace of mind to kind of know that the reason I was in pain was acceptable because I was in pain for, legitimate reasons. It wasn't just in my mind. The biggest thing I liked about Dr. Patel is when I saw him, he definitely took the time to talk with me, to listen to my story. I kind of felt like I, at that point, had become an expert in my spine. I mean, I knew exactly where the pain was. I knew what was going on. Uh, but basically, he sat down, he went over everything with me, and the experience from there was very smooth, very educational. I never felt like I was questioning what was going on, or every question I had was answered. And yeah, I just felt comfortable that I could move forward. And I remember specifically, I asked him after everything, our meeting and all that, I said, if you had a family member in my situation, would you continue with surgery? And he said, absolutely yes. And that's what really gave me the confidence to move forward, because I was hesitant, because I had seen several other surgeons who, some of them wanted to fuse my whole spine. Some of them were too scared to touch me because of what had happened in the past. And yeah, so I felt very comfortable moving forward with him. Surgery day, I was nervous because I knew it was going to be painful, but I also knew that the short amount of time I was going to be in pain would be worth it. I had met a lot of surgeons before that didn't seem confident, and Dr. Patel 100% seemed like he was confident in what he was going to do, but also calm. And I think that's important on surgery day. But surgery went well. Obviously, it was uncomfortable afterwards, but they managed my pain very well. At no point was I ever miserable. I was able to get up and walk later that day and just kind of continue the healing process. And all in all, the entire experience was great. I mean, the nurses couldn't have been more kind. Like, I literally felt like their daughter. I mean, they genuinely seemed to really care about me and accepted my family when they came to visit, explained everything to them. I didn't leave the hospital with any questions, really. They answered all of them for me. My pain levels, to be honest, is 0. And to be able to say that is life-changing. I don't say that lightly. I was expecting, because my pain was a 7 or 8, I was on pain medication, I was in pain management prior to this. And I didn't want to be a 36-year-old woman in pain management. That was not okay with me. That's why I pursued surgery. But yeah, I was expecting if I could walk out of surgery with a 5 or 6, I'd be happy. I mean, I was that desperate. So to have no pain, it's life-changing. Like, literally, it's life-changing. And I'm able to get back into the arena and start riding again this summer and competing, and hopefully get back to, the level I was at before. But yeah, it was life-changing for sure. I would definitely say prior to surgery, be educated on your spine, where your pain is, know exactly where your pain is so that you're able to pinpoint for your surgical team to know exactly where they need to focus. And make sure you have exhausted other options. I literally did everything. I mean, TENS unit, nerve ablation, previous surgeries, SI joints fused, you name it. I did all of it. And then, but trust your gut. I would definitely say trust your gut, and then sit down and find the right surgeon, which obviously I think it's Dr. Patel, and let him know your story. He'll take the time to listen to you for sure. But if you're going to move forward with surgery and it's the thing that Dr. Patel recommends, then move forward with confidence and peace, because you will absolutely have a different life afterwards. Expect some pain. It's back surgery. That's normal. But all in all, I think that if you're ready to have your life change and live without pain or less pain, then definitely move forward and move forward with confidence. And then to my care team, I would want to definitely say thank you, Dr. Patel. You changed my life. You have taken the pain away, which is awesome. To all the nurses, to the entire UC Health staff, they were wonderful every step of the way, answering all my questions. At no point did I ever feel like I was annoying them with questions, because I certainly had a lot of questions, but I definitely felt cared for. And so thank you. I just want to say thank you.